Hello everybody. So today I have on DAMS studio with me Dr. Husain Abbas. Congratulations and welcome Husain Abbas to the DAMS Delhi YouTube channel. Welcome
Thank you so
Husain.
much, sir. Thank you.
So Dr. Husain has secured marks of 635. 635 in NEET PG 2021. Awesome results. Very good. Congratulations Husain. How are you feeling now?
So it's a great feeling. I always dreamt of being interviewed on such a platform. I've been watching interviews for a first year, and I couldn't have imagined that I'll be sitting here and being interviewed by a prominent teacher like you. It's a great feeling.
Thank you so much for that. You know, you always deserve the stage, and it's your hard work which has paid off. It's all your dedication and commitment. So I'll start from the beginning. When did the thought of preparing for pre-PG came in your mind?
Sir, I was aware of NEET PG and the challenges that would come if we don't start early from first year onwards. So, but I realized that. Yeah, but I realized that people said that it's important that you first stick to your standard books, at least for the first 2 years, and then you see coaching in sixth semester. That time, the concept of next hadn't been introduced, so we were accustomed to be joining in sixth semester. So like most of my batchmates, I considered joining in sixth semester, but I started solving MCQs from second year onwards, because second year we have that extended period of time semesters. So I thought in pathology, pharmacology, and microbiology, whenever I used to get done with topics, I started solving some MCQs just to realize what the issue is, like how to go about it in the future, to have an upper hand from the beginning. So that's what I started doing from second year, and I officially joined DAMS for the 3-year program from sixth semester onwards, sir.
So you joined from sixth semester onwards, but considering you just mentioned the changes happening, what do you recommend to your juniors to start the preparation from third year or earlier?
Sir, earlier, sir, Dr. Sumer sir mentioned in one of the videos that the fourth semester would become the new sixth semester. So because the exam would be happening as a final year exam, so we have to start in a year earlier. So we have to start from, we used to, the ideal way to start was sixth semester, but now it will be fourth semester. So it's better to be ready earlier on.
So when you started with sixth semester, you joined face-to-face coaching classes. So you joined DAMS Delhi Center. Delhi.
Yes, sir.
You are MBBS from Hamdard Institute.
Yes, sir.
Yes. So how was your experience when you first joined classes? It must be face-to-face. Which center of DAMS Delhi? Where? Gautam Nagar?
Gautam Nagar, sir.
So how was your experience when you first attended the first class?
It was very fruitful and enriching. Initially, it might take some time for us to set it, considering there are heavy classes over the past in the initial few weeks. But then it becomes a schedule. And the way I used to deal with it is, and that's how I recommend to juniors as well, that it is a very big commitment, but an absolutely necessary one too. So you have to put in a lot of effort. You have to sacrifice your weekends, but for the bigger goal, the bigger dream in hand, in order to achieve that, it is necessary. You have to make those sacrifices, and within a few weeks, you start enjoying the process. It'll become a schedule. It'll become a part of your daily schedule. That I have to, or your weekly schedule. That I have to attend classes. I have to complete notes, revise notes, do questions, and carry on doing the process for every subject. So it becomes intrinsic to you as a part of your weekly schedule, and then you start enjoying it a lot. And as such, the teaching is very clinically oriented. So you always had an edge that people are saying that the change in pattern is going to be a difficult terrain to cross. But because in DAMS, all teachers teach every subject in a clinically integrated manner, in a clinical vignette and aspect manner. Therefore, that crossing the terrain for any DAMS student was far easier than for anyone else, in my opinion.
So, you know, sometimes the students ask us a question, which I would like to ask you as a student. In third year, should I focus more on third year and final year subject, or should I revise my first and second year subject? According to you, what do you recommend to your students, juniors?
Sir, I feel that you have to. I feel that the way to go about PG preparation in general is that you have a broad outline, which is a general outline which everyone follows, and you have to fine tune it according to your strengths and weaknesses. So you have to assess.
Yes.
Okay, fine. I'll be doing final year subjects in third year and first and second prof subjects in the final year. So I have to assess what my strengths and weaknesses are. If at all I require, because I said that I had already started doing MCQs of path para micro. So for me, the transition was that question was answered rather easily, that I have to focus on the pre-final and final subjects and also give me an edge in my professional examinations. But if a person feels that they haven't given enough time to their first and second prof, they should assess. But the main problem that people do is that the main problem that occurs in the preparation is that they try to jumble up things. They try to do everything, and in the end, you end up achieving nothing. So you have to assess that, okay, fine, I in first prof, anatomy was a bit shaky. In second prof, path was a bit shaky. So I'll do these two right now, the weaker ones, along with my rest of my preparation, and I'll leave the rest for final year. So you have to assess your own strengths and weaknesses and make the decision accordingly, sticking to the general outline which has been provided by the DAMS teaching curriculum.
All right. So in third year, you finished third and final year subjects. And then in final year, you revised the first and second year subjects. Then in internship, you followed it up with test and discussion.
Yes, sir.
How was your experience with TND?
Yes. So I think that during internship, time is of the essence. As you mentioned in one of your videos that you used to read while you were walking, while you're sitting in the not attending to patients, and that's how you're supposed to read. Time of the essence, because you're competing with people who have all the time in the world, the people who are taking a drop year. So you have to utilize all the possible time that you get, and in that context, TND becomes a savior because it gives you a schedule that I have to finish this subject in this week, or I have to finish this part of the subject in this week. So that gives you a schedule to follow, and that helps you maximize the productivity during your internship. So the way I used to go about it was that I used to try to revise as much as possible of the particular subject for the test and discussion, and take the test. And it's very important to take the test and not just attend discussion. I've seen people directly proceeding to the discussion. Then you won't be able to utilize the TND to its fullest productivity. You have to take the test in order to assess yourself and then build on it, and ensure that within a day of the discussion you finish up the discussion part and whatever remained of the subject. So one might feel that you might have for example, in the first TND you miss 10%, 20% of the syllabus, and in the next TND you miss 10%. One might feel that you are adding up uncovered syllabus portions, but I feel that the solution is that there will be certain subjects which will be your strong suit, in which you will be stronger. So you'll cover them in lesser amount of time. So effectively speaking, it'll get balanced, and you'll be able to revise all subjects in a productive and effective manner through a structured outline class like the test and discussion batch.
Okay, so by the time TND finished, you must have finished your reading.
Yes, sir. I had finished my first reading, sir.
So how did you plan to revise after the TND finished?
So I through the discussion, through the TND, I realized what my strong and weak subjects were. So I decided that I'll give more time to the weak while not ignoring the strong. The strong needs consolidation, but weak needs more work. So stronger subjects, you can go for a strategy of practicing more questions. While for weaker subjects, you have to revise your notes more thoroughly. So that way I divided my time and I tried to do my second reading in a quicker manner.
All right. So when you completed your second reading, you must have given November INI CT?
Yes, sir. I did, sir.
Okay. After November INI CT, when you plan to prepare for NEET, initially it was in January, then postponed to April. How did you handle this postponement timing?
Yes. Sir, it was difficult because I had completed my preparation according to the respective dates, like in January and in April. But DAMS provided us with classes which helped us bridge that period, bridge that gap. So, for example, I revised my DBT videos again during the Jan to April extension. Then there was the must know topics class, which I revised again in the second extension. That way, I was always occupied with revisions, with taking tests, and with practicing enough questions in order to be as exam ready as possible.
Yes. So how was your experience with DBT?
So DBT was very effective because of the clinical integration platform that it provided. We had a bunch of teachers who were explaining a particular, like for example, say we take cardiovascular system, which is dreaded by most students, and following the session of cardiovascular, for example, I felt very confident that I will be able to deal with any CBS question effectively, and similarly for neurology, and similarly for individual subjects as well. So it followed a 2-point perspective. Number one, it helped us consolidate the clinically applied aspect of every subject, and also secondly the clinically integrated aspect, that how can you deal with a question of anatomy in the form of a clinical vignette, or how can you deal with the question of say pharmacology, which is a basic science subjects, in the form of a clinical vignette. So these are the two advantages that I felt.
And how was the must know series that you attended?
Some must know when I was doing the must topics, I considered it to be a consolidation of whatever I've read over 1 year. So it served as an effective tool to bridge any gaps or any lack that I thought that I had in my preparation, and have one final consolidation before I'm completely exam ready. It gave me that I feel that must know topics gave me that additional edge, that additional motivation and confidence to carry on.
Okay. And how was your experience with the DAMS test paper? Any CBT grant test did you give?
Yes, I used to take GTs regularly and CBTs. One of the problems that I felt that I had, which ensured that because of which I felt that my rank fell, was that I did not take the CBTs in the computer lab. I gave it in the home setting. And initially CBTs were being conducted only because of COVID-19, only at home. But even when it became a center, the center option was there, I couldn't, because of I couldn't take that option. And I feel why my rank fell was because I wasn't accustomed to the proper setting. INICETs that I took in November and July gave me that practice. Would have had much more practice had I gone to the computer lab and taken the CBT.
All right. So you recommend students to give CBT in the center itself. That's your recommendation. Important for the students to note.
Yes, sir. Yes, sir. Because that will give you you're sitting there for 3.5 hours in the as good exam setting as possible. It is recommended that you take GTs like that also. That you shut your room, you keep a bottle of water with you, and you just concentrate on the test. But it is not achievable in the home setting. For some people it might be, but from
Yes, you were telling us about giving in the center.
Yes, sir. I feel the advantage of we are encouraged to take GTs at home also in the near perfect setting. Shut your room, keep a bottle of water, and sit for 3.5 hours and take the exam. But for some it may be possible. For most there would be some kind of distraction, or at all you'll have this tendency to just go through something and mark an answer. Go through your notes and mark an answer. You'll have that tendency. But when you're in the CBT lab, when you're in the computer lab, that's the best simulation, the most near simulation to the actual exam setting that you would have. And that will make you exam ready as possible.
And that exam skill is very important.
Yes,
so
sir.
On the date of the exam, with what mindset you go? How many questions you attempted?
So I attempted 195 questions, sir.
So according to your rank, you must score you must have got approximately How many correct?
Sir, I had calculated my marks to be 640 and they came to be 635. So I'm unsure as to what
But
would
more
have
than
been.
160
I
correct.
must have got 160. Yes, more than 160 plus correct, and the remainder negative, and I left 5 questions.
All right. So what is your opinion about this paper, NEET PG 2021? Will you count it on easy, moderate, heavy? Because students who are preparing for NEET PG 2022, shall they take 2021 exam as the benchmark?
So I feel there was talk of the shift to the clinical integration in the vignette pattern in light of next 2023. So I feel that, but as Deepthi ma'am and Sumaya said in one of the videos, our version of clinical vignette is very different from the USMLE version of clinical vignette, where you have a proper extended question. Ours is the same thing, but in 4 lines. So I felt the paper was of moderate difficulty. The questions were tricky. For example, I'll give an example. The folic acid question, for example, that I made a very silly mistake in that. I straight away looked at megaloblastic anemia, and under the pressure of time, I marked folic acid, not realizing that the question was asking she's not eating fruits and vegetables. Things like that. You may. So it was at first it felt like megaloblastic anemia. It's easy, but you had to assess the question.
So it was.
Okay, sir.
Yes, Husain, you were
So,
saying
for
something.
example, yes, sir. I felt that paper was of moderate difficulty. The questions may have appeared easy, but they were slightly tricky. For example, in the folic acid megaloblastic anemia question, at first it appeared to be an easy question, but you had to read the line that she eats fruits and vegetables, and that was the segue to making the right choice. Similarly, there were a few tricky questions in surgery and obstetrics as well. So you had to maintain your concentration for the entire duration of the exam in order to get every question right. And I felt that I wasn't able to carry that momentum throughout, and that's the reason why I made some silly mistakes. So I'll encourage everyone to make sure that you set your mindset accordingly. That, for example, what I did in the run-up to the examination, I was still practicing GTs at my convenient time. I practiced GTs in the afternoon, and morning I used to do my study sessions, my notes revision. So, but I should have started practicing GTs in the first half during the actual exam setting of 9 to 12:30, and because I had fixed my biological clock of waking up at 6 and being prepared accordingly, but I had not set my mind to be my sharpest during 9 to 12:30, the actual period of the exam. So, in the run up to the examination, you should start practicing GTs during the actual exam time, because that will train the brain to act accordingly. And so, regarding GTs, I have one more point to make, if I may, sir.
Yes, please.
Yes, sir. I feel that everyone says that you should start GTs as soon as as early in the preparation as possible, and it'll be effective. So that is completely true. But what I feel is that the nature through which you take those GTs, that differs. Remember, in the first half of preparation, you're attempting every question. You are not leaving any question. You're even attempting questions that the subjects that you may not have revised, because the purpose of GTs that time is to assess your recall, to assess your knowledge. And in the second half of the preparation, in the run up to the examination, it becomes to develop and hone examination skills. So then the aspects of GT taking, like selective leaving, smart guesswork, that come into play. So you have to distinguish your start taking GTs as early as possible, but you need to distinguish it from the first half and second half. The first half being the purpose being checking your recall and checking your knowledge, and second half being
Exam
your
skill.
examination skills.
Yes.
That's
Suppose you are from 2015 batch, you just completed internship. Out of all the interns, a few got selected and many are still remaining. Suppose one of your own batchmate, friend, colleague wants to ask you, and now NEET PG 2022 is in March or April. I've got 6 months to prepare for NEET PG. Actually, you have been preparing since third year, but there are some students who started preparation a little late. Okay. So from the undergraduate perspective, you have already said to us from third year to final year to internship TND. But suppose somebody wants to start now for 6 months he has for NEET PG. What is your advice to one of your batchmate who is a post intern who has complete 6 months to prepare for NEET PG? How he or she should prepare according to you?
So I feel the most important thing is that you should not feel that you can't do it. That
Exactly.
I don't have I have 6 months. I have half the time that a usual candidate has. The people who must have been preparing before me. 6 months, provided that you dedicate yourself completely and have a good schedule of study. Because unless you have a plan, you won't be able to achieve your dream. And unless you know the exam, you won't be able to achieve your dream either. So, in order to beat the enemy, you need to know the enemy first, and then have a plan to beat the enemy. So, my advice is watch videos like these to understand what kind of exam it was. Go through the this year's questions. Go through the previous 3 years questions. What are the focus areas? Because the questions might change, but the focus areas remain the same. The key topics remain the same. And when time is of the essence, it's important that you focus on the key areas rather than building low yield information. You focus your preparation on high yield content. So you have to spend a few days in assessing and understanding what PG and what are the focus areas. And second is to have a plan, that you have a proper plan. This is the way I'm going to cover each subject. This is the way I'm going to consolidate each subject. And thirdly is to take frequent tests. Don't get bogged down by marks, because the purpose of taking the test right now is not to test how exam ready you are. The purpose is to assess your recall, number one, and number two, to set you in the motion, because my first and second half philosophy does not hold true in this scenario. In this case, you have to do both together. You have to assess the recall as well, and you have to be exam ready as well. So the most important thing is having a schedule, and DAMS is provide. And I feel that the person should think. I feel that if you feel that you worked hard and still weren't able to get the desired rank, you should need to assess: are my concepts clear? Is my foundation strong? Then you should go for a TND course. And if you feel that your concepts lack clarity, if you feel that your basics are not set in stone, then you should go for a regular batch kind of a course. So you have to, each is an individual choice. You have to assess, where do I stand right now? Even people who might be getting decent ranks might have got that because of good exam practice. The basics might still be lagging behind, and that's the reason why they weren't able to bridge that gap. So you have to assess. Fine, okay, it does not depend strictly on your rank. It depends on your personal assessment. Okay, fine, my foundation is not good, so I should go for a regular batch classes. My foundation is good, I should go for a test and discussion batch. So accordingly, you have to decide.
Yes, that's a very, very good advice, because nowadays, of all the students who are not selected, many of them are asking us whether I should go for a regular batch or a test and discussion batch. So if you have the notes, if you have the confidence over your theory, then TND would be better for you. And if you don't have, then regular is a very decent choice. So very, very well said, Husain. So before we finally conclude, any final words of wisdom from your side, unbiased, anything for your juniors without me asking a question?
Yes, sir. So I would like to show some of my notebooks that I had.
Please go ahead. Go ahead. Yes, yes. I would like to see it.
So, this is, sir. We all know the concept of the 20th notebook.
Yes.
What whatever is volatile, all that content into one. I have a concept of a 21st notebook as well, in addition to the 20th notebook. It's my personal concept. This is my 20th notebook, which is basically volatile things about every subject. For example, I have a, apologies for the handwriting. For example, I have all these subjects listed: ENT, ortho, ophtha, and I have all the highly volatile information.
Yes.
So that I can just flip through it a couple of days before the exam in order to just reinforce the volatile subject matter. And the second, which I feel is way more important, if not as important, is my GT notebook.
Okay.
Sir?
Yes, I can hear. Please go ahead.
Can you?
Yes.
Yes, sir. So this is my GT notebook. So after taking every test, I jot down all the. You don't have to write explanatory statements in here. Just point-wise information of the questions, particularly the question that you missed, that you weren't able to do, or that you got wrong. Mainly those things, or any other additional point that you got through the discussion that has been put here. So these two notebooks become your high yield content to revise in the absolute run to the examination. In the last week of the examination, I had in IICT, which I think was one of the major factors why I wasn't able to achieve a rank like this in IICT, was that I was very anxious. I felt that I have to read everything, that everything should go in front of my eyes in order, otherwise I won't be able to do this exam. But that is a logic that people use during professional examinations. In comparison, PG preparation is a 3-year fight, or at least in the most effective in the 1 year run up to the examination. So it is not at all what you read the night before. It is what you have read and consolidated over the entire year. So in order to ensure that you remain productive, that you remain effective, and you get rid of that anxiety, such resources like your GT notebook and your volatile notebook, they become very effective tools to counter that and be productive at the same time.
Very good, excellent piece of advice. I'm sure the juniors would like it. Okay, Husain, anything else you want to say before we call off?
Sir, I like to take this opportunity to thank all my teachers and mentors in DAMS and the people working behind the scenes. It has been a joyous ride. I have fallen in love with subjects that I initially was displeased to read, and I feel that I've developed a more clinically integrated approach to the subject matter in general. And my most important advice to all the exam going people is that never to give up. I know it may sound like a cliche, but I feel that I'm an example of that, because I was my college topper, my professional topper, in first, second, and third partner examination, and the overall top of my batch. And people had high expectations from me in November NICT and in July NICT, but I was unable to meet those expectations, and that led to significant disappointment. But rather than giving up, it's important that you continue to fight, continue to put in the effort, put in the hours. You have to make some sacrifices, but at the end of the day, it all be worth it.
Yes, that's the most important piece of advice, that you have to keep trying and give your best shot. Thank you so much, Husain. Thank you so much for being over here. I'm sure the juniors would be helped. Okay, thank you so much.
Thank you so much. Good night, sir. Thank you so much.
Good night.